having Daktari who is explaining to us, of course, the context behind kidney problems and the kidney health, of course, what matters right here in the country. And of course, you want to elaborate for us the causes of kidney problems, how they're initiated, and how does a patient understand that this is a problem?
Yes, thank you. We have several causes of kidney failure. We have what we call acute, which is sudden.
Indeed.
For example, you can get malaria and your kidney can suddenly fail. You can have diarrhea and vomiting, and out of losing a lot of fluid, your kidney can suddenly fail. If somebody gets an accident and they bleed a lot, their kidney can suddenly fail. If a woman delivers and loses a lot of blood, the kidney can suddenly fail. Now, for these particular causes where the kidney has suddenly failed, if we are able to remove the cause of or we are able to address whatever has caused the kidney to fail, if the patient even has to do dialysis just shortly, and then the kidney will recover, and sometimes it does it very fast if we are able to intervene on time. But we have other causes where the kidney fails slowly. For example, if you have hypertension or you have diabetes, I usually like giving these two great examples, which are such a great threat to our community. This is where it affects the soft parts of the body, like the eyes, the heart, and the kidney. And in this case, for the kidney, it fails slowly, to a point now it's not able to function. And once the doctor realizes it's not able to function very well, and you start now presenting signs of end stage, this is where now you require dialysis. You are referred to go for counseling early, and then you are initiated the dialysis. Yes, thank you.
There are some of the causes as well that perhaps you might mention in terms of the effects to this kidney.
Like, for example, if you get infection, for example, you can experience a burning sensation when you are passing urine. Maybe you have just contracted a what we call urinary tract infection. This is something that you just need to see a doctor and get treated adequately and take your medication fully as the doctor has prescribed. But if it is not treated adequately and it's able to migrate to the kidney, your kidney can fail. Again, also, for example, the way somebody gets an upper respiratory tract infection, the way unapata homa, if it is not treated properly, the bacteria can also migrate to the kidney, and your kidney can get affected, and it can also start failing again slowly, causing damage to the kidney. Yes.
Can it lead to the entire body being affected as well?
Yeah, the body can still be affected as well, because once the kidney, kidney is a vital engine in the body, and once it is affected, the whole body again is affected. And when it is not working well, it's not able to remove the waste, and we call those wastes, like, I like using the word poison, because once that poison is high, those urea and the creatinines, once they are very high, it affects the way the body is functioning, because there are people who will experience fatigue, others will start vomiting, others will experience diarrhea, others will start even nose bleeding. And once the doctor goes to do thorough tests, for example, removing the blood and checking through the laboratory, they will find what we call the creatinine and the urea. They are very high, and once they are high, we say this is a threat to the body, we need to do something, especially if the patient requires dialysis urgently. Yes.
Many times we speak about kidney problems becoming a silent threat due to the fact that we might not know that the disease is cropping in.
Yes.
So the time now when it's fully grown, that is when we realize that, nilikuwa na ugonjwa ya kidney.
Yes, we usually say that quite a number of our population, they have what we call one form of kidney disease or the other. And we have 5 stages of kidney failure, where stage 1 up to stage 3, they are very, very silently, especially for someone who doesn't visit a doctor once a year, because if you are able to visit a doctor once a year, he can detect whether you're in stage 1 or you're in stage 2 or even you're in stage 3, where you still need follow-up. They are very silent. But now when you reach stage 3, this is where the kidney is silently failing, and now you have started manifesting the symptoms of kidney failure, and now you need maybe quick follow-up. You need to be seen maybe after 2 or 3 weeks or maybe a month.
Indeed.
And we are now preparing you for dialysis, especially if the kidney is failing slowly. But for what I had actually earlier said about acute kidney failure, that one usually comes suddenly and intervention are quick. But for chronic, it fails slowly. Yeah.
You spoke about the stages, that is
Yes.
stage 1, 2, and 3.
Yeah.
What's the difference?
The difference is for stage 1 to stage 3, I'm saying they are silent. This is where, like, for example, if you usually go to see a doctor once a year, because it is recommended for every person to be seen by the doctor once a year. There are people who have insurance, but they have never even gone to the hospital that whole year. So the insurance money just goes back, or it's the cover inaishia tu hivo. But if you're able to check in for simple tests like checking on your urine, we call it urinalysis, the blood pressure. Sometimes they also do blood works where they will check on the functions of the kidney, also checking or even on the function of the heart. Very simple tests, but they can also tell us how you are faring, and also again checking on your blood sugar, because again, if it is high, it can affect your kidney. If your urine has a problem when we are doing the urinalysis, for example, if we are doing a urinalysis or a urine test and we realize that your urine has protein, usually say that the kidney should not allow the protein to pass unless it is having a problem. Therefore, when the doctor realizes it has allowed a protein to pass, it means you need further tests. You need to be checked further.
You've mentioned urine has protein.
Yeah.
Okay.
It's not supposed to allow protein to pass. Yes.
All right. So kidney disease is rapidly becoming a national health crisis in Kenya, with thousands of people struggling to access life-saving treatment. Now, the situation has worsened in recent months due to increasing healthcare costs, inadequate medical facilities, and a weak public health system. Patients and their families are facing unimaginable hardships, making kidney disease as a major public health concern that needs immediate attention. Before we get to the immediate attention and how to advance the medical health sector right here in the country, earlier on we had spoken about having one kidney, having 2 kidneys, and of course, if we are requesting donations from donors from any other place, it's not a crisis.
Okay, what you're saying is that like you can be born with 1 kidney. And it can serve you. Yeah, it can serve you until you die. I remember sometimes back I met a patient who had diabetes, also had a cancer problem, and he was around 76.
Indeed.
He didn't know that he had 1 kidney until like around that time he was over 70. That's the time he realized, hi, you mean I had only 1 kidney? Because you can be born with 1, and if it is functioning well, you may not be having a problem because it is removing all the waste, it is doing all the functions of the kidney. And that's why we say when you are looking for a kidney, the person who will donate will remain with 1 and is not going to be overworked. Why? Because it will remove all the waste, it will balance all the chemicals of the body, it will do all the works a kidney is supposed to do.
I was trying to think, Dr. Ari, about development of all these 2 kidneys. They practically are used to serving equal purposes, the 2 kidneys. Of course, I'm trying to understand the one with a single kidney,
with a single kidney,
and functions the same way.
Yes.
But on the other side, we have that with 2 kidneys.
Yes.
And of course, the 2 kidneys have their basic functions as well.
Yeah. Okay. Well, the research has shown that if you give out one kidney, you will remain with one, and it will serve you very well without a problem. But before we reach to a point of removing that one kidney, we have to do series of tests to confirm you are okay. The two kidneys are okay in size and shape.
To confirm that if I remove one.
Yeah, first of all, we have to make sure the ones that you are having, they are serving you very well and completely very well. And now again, the tests have to confirm to us that if you remain with one, it will still serve you very well. Therefore, we have to do series of tests to confirm you are okay, such that if you remove one, hatutakuwa tumekuibia. Why? Because the ones that has remained will pick up the function and it will take care of you until you die.
We need to be very careful.
Yes, we have to do series of tests. In fact, it's not a one-day thing. It's like a journey where we have to do preparation like for almost 2 months, where every week they visit the clinic, they are evaluated, several tests are sent to the lab to confirm our donor is okay. At the same time, the person who is receiving the kidney, also his body is okay to receive the kidney.
Talk to us a little bit about shortage of specialists. Of course, Kenya is currently facing a severe shortage of nephrologists, that is kidney specialists, with only a handful of trained experts. Most kidney patients have to endure long waiting times for diagnosis and treatment. So public hospitals, particularly in rural areas, lack specialized kidney care, forcing patients to rely on general practitioners who may not have the expertise to handle advanced kidney diseases cases.
If it is possible, I would recommend, even in that dispensary, we need a renal nurse.
Indeed.
We need a renal doctor, a nephrology doctor. In that dispensary, it will help us in early diagnosis and timely treatment.
Indeed.
Because now, for example, for chronic kidney disease, for example, those people who have diabetes and hypertension, they need proper treatment. They also need proper follow-up. And you know, for the renal specialists, if something is a key marker, they will be able now to even timely do recommendation. Can you go to the next facility for 1, 2, 3? However, because of shortage, maybe their patient we miss, or they come when it is very late, when they have experienced late symptoms, and now they are coming for treatment when it is too late. They are coming now when they are just about to start dialysis. However, maybe we would have slowed progression to what we call end stage, where we need to do dialysis. Huwa tunasema, if it is possible, can this slow progression to end stage be even slower and slower, meaning that that kidney, if it is possible, can it serve us even for many years before we reach to a point of doing the dialysis? And once we're able to manage, for example, those diseases like diabetes and hypertension very well, we'll be able to slow the progress. Yes.
What are some of the challenges that kidney patients face, trying to find solutions for cure, trying to find ways to endure? What are some of the challenges that they go through?
Okay, some of the challenges they go through, and when as an expert in counseling, immediately after diagnosis, many of them experience what we call denial, refusing to accept the truth that you have kidney failure. And in the process of denial, they seek many opinions. They visit many doctors here and there. Some of them, they go for prayers. This is where you will find what we call religious addiction and religious intoxication. You'll be prayed for, you will take the oil, but your kidney is not improving. But this is happening because of what we are calling the denial. Then there are those who go through the bargaining and they're like, God, if only you would heal me, this is what I'm going to do. There are those who experience what we call depression. being in very, very low mood, and some of them at that particular moment, then maybe they need treatment for even that severe depression. Acceptance does not come easy for them. So you will find they have started treatment, they have defaulted. They have just started taking medication, they have defaulted. They have started dialysis, today they don't want to go for dialysis. Why? Because they are experiencing the denial. So acceptance to them, sometimes it does not come easy. They have many challenges, even the financial, and as a result, their work is affected. And when their work is affected, it means what they need to go for dialysis twice a week. They need that off. Sometimes the employer is going to make a loss because the most important person is not present. So what will happen next? They're going to lose their job. Some of them will experience constrained relationship, even at home or maybe even at work, and it becomes a challenge. So the challenges are quite huge, and there are many.
Of course, weak prevention and public health strategies. Prevention remains a neglected aspect of kidney health in Kenya.
Yes.
Of course, despite the rising number of kidney diseases cases, there are minimal public education campaigns about risk factors like poor diet, high blood pressure, and diabetes. Without urgent action to promote kidney health awareness, more Kenyans will continue developing preventable kidney diseases. The kidney disease crisis in Kenya demands urgent intervention. The government must act fast to improve access to affordable treatment, expand dialysis centers, and address SHA's inefficiency. Talk to us about SHA.
If there are patients who have really benefited so far, they are the kidney patients and the cancer patients when it comes to SHA. So I'm like, thank you very much, SHA.
Indeed.
Because for our patients who are on dialysis, twice a week, they are benefiting from SHA, where one dialysis session is 9,500 if you don't have SHA. But once you have SHA, it's able to pay that. For those who are preparing for transplant, for example, in our facility, SHA is able to pay up to 100,000 pre-transplant preparation. During surgery, for kidney surgery, after surgery, SHA is able to reimburse 700,000 for donation. Then it's also able to pay for the donor 168,000. For those who have received the kidney, NHIF never used to pay for medication post-surgery, but SHA is able to pay for us 16,000 every month, which is equals to around 200,000 per year. And to us, that is a huge milestone for our patients because they have been experiencing that financial burden, and SHA has come to really help our patients.
So do you think SHA is working?
For us, it is working. I can say for our renal patients, it is working. And for those facilities which are SHA accredited, patient can just check in and do dialysis 2 sessions per week, which is just a great thing. Yeah.
Right. The cost of treatment, the kidney problems, is also a crisis.
Yeah, it's a crisis because for our patient, even if they're on dialysis, they have frequent medication that they have to take, like for example, every day. If you are diabetic, if you are hypertensive, or maybe whichever condition that made your kidney to fail, they are those drugs the doctor has put on the patient, where they need to follow. Every month they go for renewal of the prescription, and when they go for renewal, for example, in our facility, they have to pay 1,100 for consultation, where they need to see the doctor. Then they have to go pay for the investigation. For example, how is their kidney function, how is their blood level, is there infection. So you will find by the time they get seen by the doctor, they have spent like 3,000 or 4,000. Then again, they have to go pay for medication, and they have to do it every month. So it means kidney disease also comes with a with a cost attached. They also have to take a special diet which has to be prepared in a certain way, and the family member also need to understand and know even how to prepare that meal, which is also equally still a challenge for the family and even for the patient. And we even have to teach them how to cope with the diet, with the dialysis, with the drugs, with follow-up, all that without failure.
Indeed.
Yeah.
And of course, in the next few minutes before we take a breather, let's try understand now the burden that comes also with stigmatization in the society, in the community where they live, and they're facing so much stigma that they cannot endure at all. What would be the preferred way to educate, create awareness about this particular disease, and of course to evade stigmatization in the society about this particular disease?
So let me start by explaining to a normal Kenyan, when someone has a kidney failure, their mind gets affected because of what you call high urea and high waste that the body is not able to remove. As a result, some of them experience what you call brain fog, or there's that confusion. Sometimes you could be picking a conversation with them, and it's like they start answering opposite of what you had. It's good for you to understand when those creatinine and the urea are high, they're likely to experience that. Therefore, don't start judging them so harshly. Again, when those urea and creatinine are very high, some of them become very irritable. Therefore, you will find them shouting at you and thinking that you're also not listening to what you are not even understanding them. They need also a lot of understanding. Otherwise, you can really judge them. You can really stigmatize them. At the same time, you know the way the skin color looks, the way I can look at you and you look nice, a nice dark color. But now, when the urea and the creatinine are high, there is a way the waste will cause them to look like they are not looking the normal beautiful person you are used to seeing. It interferes with there's skin color changes. Then again, there is a way they have to dress. Let's say, for example, a young teenager, they have a catheter up here, or maybe somebody has a catheter down here, and now you have to really take care of that catheter so that people don't see wherever it is, and to them it really affects their image, their self-esteem, and we really need to support them so that they can continue with their normal life.
Of course.
Yeah.
Wow, amazing. That is very nice. I think that they've heard it, and because we are creating awareness since you done this last week, and the awareness is still ongoing, and I believe the entire of this March, end of this year, we'll be having a safe space for kidney patients, right?
In fact, the theme for this year 2025, it was are your kidney okay? Take care of your kidney. Yeah, are they okay? Take care of them. It's good for you to be aware. Are you having the 2 kidneys? Are they working okay? Yes.
So once we're done with this, I go check out.
Yeah, you go check. As simple as checking on your blood pressure, having your urine checked, and also having your sugar checks. We call it random blood sugar. Yeah, it can really tell us a lot.
Right.
Yes.
Just someone that is speaking to me on this earpiece loves sugar so much. I don't All right, well, we'll get to
okay, what happens, there's a way your body is able to is it, they call it inasiaga sukari. Kuna vile inasiaga sukari. Ikisiaga vibaya, there's a way the body presents.
Alright, so Doctor, when we come back, we'll discuss more a little bit on the sugar thing, and also to understand whether I should have an immediate checkup on myself as well.
Yeah.
Sylvia, and also the issue on the transplant.
Yes.
But ladies and gentlemen, of course, mental health struggles and social stigma, the burden of kidney disease goes beyond physical health. It takes a significant toll on mental well-being. Many patients suffer from depression and anxiety due to the financial stress and uncertainty of their condition. When we come back, the awareness is still ongoing on the kidney problems and of course on the kidney health. But now when we come back, Dr. will be able, or we'll be in a position to help us understand how transplant comes in, and of course what are some of the effects that comes with its condition. So this is the Morning Drift, hashtag Health Tuesday, and of course the conversation is kidney health, the silent threat and treatment. Don't go too far. We'll be right back after this short break.